morning, everybody. It's lovely to see everybody here. It's lovely to be here. We are running a little bit late, so I might flip through a few slides a little bit quicker than I might have. Okay. As you know, this is my first conference with CLDF. It's my first as the Chief Executive, and I must admit, I can't say it wasn't a daunting prospect taking over from Catherine. She'd loved and cherished this charity for 22 years. She developed and she'd driven it single-mindedly, and what the charity is today is a lot down to her and her passion and commitment. So I feel very, very honoured that I've been able to take over from her, and I know that we all are entirely indebted to her for where the charity is currently at. To be perfectly honest, it was a little bit like taking over an incredibly precious baton in a relay race. It was slightly, well, it was daunting to start with. I felt as though I was running to collect a baton and the shoes I'd got on were just a little bit too big for the occasion. So I'd like to thank all of the families, the medical professionals and the staff that helped me fit in so quickly and were very, very patient with all the ridiculous questions I must have asked to try and get up to speed quickly. So my first part of my year has been about listening, looking, finding out what's happening from our team and with our team and from our families as I've travelled around the country to some of our events. I've realised that the huge responsibilities that I have in my posts are always also equalled by the huge amount of opportunities we have to continue to develop this charity. The work is not all done. We still have work to do. Although we've got 4,000 families on our database with over 90 different types of childhood liver disease, we're still hearing weekly that people who haven't known of us and wish they'd heard about us sooner. There are still babies whose prolonged jaundice is overlooked, leading to late referrals to liver specialist teams with life-changing implications. And the general public is still largely unaware of what childhood liver disease is. We know that there are an infinite number of research questions left to ask. So in our year of looking and listening, I don't want you to think that we've been doing that in isolation to keeping our programmes moving and keeping doing all the things that we know you cherish about us. I'd like to take you through some of the highlights of our year. We've had a very successful year. We've been busy, we've been active, and I'd like to just tell you a little bit more about what we've been doing. For most people, their first relationship with CLDF comes from having a piece of information, a booklet, or one of our packs, sometimes given by hospitals, sometimes accessed online. We have over 90 different leaflets, which, believe me, is a huge amount for an organisation. We can't do our medical leaflets and provide them without the support of medical teams up and down the country, and we're thankful for their help to make that happen. In the last year, we've delivered nearly 12,000 leaflets to members of the public, which represents a massive 150% increase on activity in any previous year. We know there's still more to do, though. There's still more people who need to receive information earlier in their journeys. Yellow Alert is our essential campaign. It's there to support community health professionals, to spot the signs of liver disease in babies earlier. And this year, for the first time, we've attended conferences specifically for midwives and health visitors. We've also had a major piece published in the Journal of Health Visiting. And with all of that activity, we've managed to give over 13,000 packs, a 77% increase again on anything we've done in any previous year in our history. There's still more to be done though, especially with, Yellow Alert. And later in the year, we'll be letting you know that we've hopefully finished our Yellow Alert app, because we've got to move with the times, so that we can get our message out there even further. And I'm really pleased to report this week that we've had news that the NCT have agreed for the first time to feature the campaign within its work. Support events, you tell us continually, are very, very important to you. Bringing people together, reducing isolation, and giving you a chance to meet others who are facing the same sorts of challenges. Again, we've had a busy year. We've added new venues, we've added new types of events. From laser tag to picnics. I've been to a circus skills day, that was absolutely fantastic. And they've been well attended, with 633 people taking part in the programme during the year. Of course, our support isn't just about the events we put on, and this year we've been really trying to find people where they are rather than expecting people to find us. We've attended 61 clinics this year, shared care clinics up and down the country, which, as you can imagine, takes quite a bit of time, but we think it's really, really paid off. It's a great way to catch up with people we already know, and I think some of you might have seen us this year in different locations. But as important as that is the fact that it's helped us this year to reach an additional 274 new families and young people within the year who then went on to access support directly after the clinic visit. So that's not just people finding our information and finding us in that channel, they're finding us at clinic. It's really working. Of course, our support team don't only just visit clinics either. They're available for you on a one-to-one basis to help with your journey. And the work where we speak to people over the phone, over Skype, chatting to people, having conversations and helping people in their journeys, that work's increased by 25% this year too. When we last had conference, our Young People's programme was in its infancy. I think we delivered one Closer to the Edge project. I think things have moved so quickly. It's now, it seems, almost a cornerstone of what we do. The programme is fantastic. Our Closer to the Edge programme, which that's 2014 participants there. They were an absolutely fantastic bunch, feisty. They were definitely feisty. They were fantastic. That programme is about challenging young people, facing their fears, doing all sorts of different survival activities, but it's also the first chance that they've generally had to be with other people in the same situation as that for a week, and of course with 3 crazy members of staff as well. The second project, Talk, Tell, Transform, I'm going to talk a little bit about that later, and you'll see out in the main room that we've got a lot of our Talk, Tell, Transformers out there ready to talk to you about the project in person. But it's continually evolving, and we've done quite considerable work this year to move that forward again. We added to the programme a reunion in April, at Easter I think it was, following the main programme in February, where we brought together all the people that had taken part in the project so far since its inception. That was a crazy weekend in Birmingham. They had a fantastic time, and they managed to, again, extend their peer network of people in the same situation as them. We know research is important. This year, for the first time, we've worked with CORE. It's the first ever joint funding round that CLDF's been involved with. In this year, we've delivered another £330,000 commitment towards research for 3 different programmes. The first with CORE, and then also we've been lucky enough to secure research from Dr. Neil Henderson, sorry, that's the CORE one, Professor Code, who's developing and evaluating an app to support transition for our young people, and also Professor Paul Gisson for gene therapy. We know just how important research is to you. You've told us that's why the research teams are out there. But I make a commitment to you today that we will find new ways to make sure that we keep you abreast far more often on what's happening with the research that we fund, because you're all telling us that that's what you want. So I can make a commitment to you that we're going to be delivering that. We've currently got 9 research projects ongoing, which is quite a considerable number. And when I come back off my holiday in a week's time, we'll also be launching a new PhD fellowship for this year. Publicity and profile. These are 2 really big areas for CLDF. This year we've generated 339 different pieces of press, but a lot of that is down to you. A lot of that is down to our supporters making press happen for us. And because you've done even more of that this year, in fact, we only delivered 86 press releases, so you can see how much work our supporters have done on their own. Because you've done that, it's enabled us to really concentrate on trying to put some really big pieces together, going to top newspapers and making suggestions and doing most of the work for them, quite honestly. In January, we decided we wanted to try and put something together on the 30th anniversary of paediatric liver transplant. And Sir Roy Cole, Matthew Williamson and Esther Granson agreed to our approaches to them, and the piece was in the Mail. We're also indebted to the Khan family, who answered our plea about a month ago in a top secret way to do the filming for the Pride of Britain Award. So again, shining some more light on children's liver disease. We've also had pieces in Cosmo and Bliss, places perhaps you wouldn't necessarily think of having things to do with liver disease. If you want to find out more about those, if you go to our comms team, they'll let you see the coverage, but it's really important. As well as you, our families and the parents, we know that our young people really are probably the best proponents of the work we do, and they're absolutely clamouring to be involved in it. They can deliver our messages and campaigns in a way that we can't, and we're committed to using them far more in the work that we do. They asked us earlier in the year at their reunion, if we could find opportunities for them to get involved. So we tried, and one such opportunity did come up. We were asked to put forward a number of our young people to take part in, or to try out to take part in the Rickshaw Challenge on BBC One as one of the Rickshaw Challengers, a very, very high-profile slot. There were hundreds and hundreds of applicants from projects all over the country, and the 5 young people we put forward were absolutely amazing. But I'm so pleased to be able to tell you that Flo has done it. And Flo, who you'll see on the left there, we were absolutely thrilled that she managed to get CLDF in within her first 2 minutes on the programme. So, you know, well done, Flo. She couldn't make it today, but that's because she's got her personal instructors and all that sort of thing. But not just Flo, who we'll all be following over the next few weeks, but we've got a huge group of people who want to get involved. And just before I move on, I'd also just like to tell you that Children in Need rang yesterday, and they've agreed our funding for Talk, Tell, Transform next year. So that's great. They couldn't really say no, could they? It's a brave new world out there with communications. We need to increase our impact and influence, especially from the profile side of things. So with that in mind, we've been doing some filming, we've been talking to our young people, we've been trying to find some vehicles that we can promote that get our message out about some of the things we do to try and affect a bigger audience. So I would like to premiere for you our video for this year, of one of them, there will be many, and this is our Talk, Tell, Transform documentary that we shot in February this year.
This is one of the most amazing projects to be part of, and for the Children's Liver Disease Foundation to be able to run.
This week we have done a lot of things.
This week we've been videoing for Talk, Tell, Transform to tell each other our stories to help other people understand or help other people with what they're going through.
We've done a story circle, so we sat with a chap called Simon and we talked about our lives and what we'd been through.
The idea will be we'll get 5 minutes to talk about kind of your story, if you like, your journey in sort of liver disease, your journey.
I had everything, you know, everything a young lad would want. It was all going smooth, I had a good life. And then I got told that I'd need another transplant, and all of a sudden, like that just changed my life completely.
A lot of the young people have got quite a lot to share, so it's really important that they get the opportunity to really talk about what it's like for them, and then really focus in on an aspect of their liver disease journey that they want to make their digital story around.
I found this week pretty interesting. I mean, I've expressed my own story. I didn't think I had one, but I do.
I started getting pains as the year went by. I missed a lot of school, so my grades went down. I felt stupid. I just felt like the world was coming to an end for me.
It was very emotional, but we all trusted each other and we felt that we could all talk to each other, even though we'd only met for like a day or two.
It really helps actually, just listening, because it makes you feel like you're not on your own.
Everyone's been through the same thing kind of, but in their own way, so we can all relate.
It's been really, really interesting to see the different processes that young people have taken to express their journey through using images of their life, so through photographs, things that mean lots to them, or whether it's being really brave and sitting in front of one of these things and just getting it all out.
It's a big thing to talk about, and then to speak about it in front of a camera I think is quite hard, but you know, once you start doing it and then once you're done and you see the outcome, it's worth it.
It's good to kind of see what I've been through, because you try and not hide it, but keep it away from everyone else, because it's easier.
It was very emotional, but it was good to get it out, and it's good to know that you've got people there to trust and someone to turn to if you ever need any help.
Also, we have done lots of different activities, like we've been go-karting, we've been laser tag, we've been out for food almost every night.
We were just getting to know more about each other, and now we're just one big family.
For us to be able to share the young people's stories on the website for other families, those that have just received a diagnosis, to gain hope and inspiration from these teenagers is an incredibly important part of the work that we do. But most importantly, to allow these young people to go home having made lots of firsts and lots of friendships, I think is great.
For anyone that's thinking about coming on Untitled Transform, I'd say go for it. It's an amazing experience, and I was really scared and nervous and not sure if I wanted to come, but I'm so glad I did.
It's a great way to express your feelings to people that understand. You have a good time and you can just be yourself.
So proud of just everybody. I've just had fun. It's just been amazing.
It's a great time, it's a great laugh, everyone is nice. It's been a great time to show that we are just normal and we're not any different to anybody else.
They're amazing, aren't they? They say it better than we can. So when you see outside the big space that says video booth, that's because if you can, and I'm talking to everybody in the room, researchers, medical professionals, families, if you can be brave, if you can speak into that camera, we're taking snippets from people talking in different ways about different things that mean things to them about CLDF and about other aspects of liver disease, so that we can start putting together films like that, current modern films that we can use to help us engage far more people. So I'm going to move on. I'm going to leave you to your fantastic programme. It's a year on for me. It's been an absolutely fantastic year for me, and I think, as Tom alluded to, I am still very much learning. But the strategy we come up with for 2015 to 2020 will be entirely influenced by all of the views and the things that we've learnt over the past year. So I'll leave you to the rest of your day.